Hi everyone, my name is Claire Hinning and I am the Marketing Communications Consultant here at HOC Navigators. You may have received a packet of seeds attached to your invitation to view this video today. We included these seeds as a symbol to help you plant the seed in making your own healthcare decisions. We also hope that this will help to plant the seed in others to help them make their healthcare decisions. Today you will hear from Laura Alexoff, our Advanced Care Planning Liaison, and Stephanie Lung, the Project Specialist for our Advanced Illness Programs.
Thanks, Claire. Today, April 16, is National Healthcare Decisions Day, and we're so glad you joined us so we can share our passion about the importance of what this day is all about and how your actions can positively benefit your personal and professional lives. National Healthcare Decisions Day exists to inspire, educate, and empower the public and providers about the importance of advanced care planning. A key goal of National Healthcare Decisions Day is to normalize the topic of advanced care planning. National Healthcare Decisions Day helps people understand that advanced healthcare decision-making includes more than living wills. It's a process that should focus first on conversation and choosing an agent. I'm Laura Alexoff, a hospice and palliative care certified RN. I have 25 years of experience at Hospice of Cincinnati as a hospice home care nurse, and I'm currently the Advanced Care Planning Liaison for HOC Navigators. I've taken the Respecting Choices Advanced Care Planning course, and I'm a certified facilitator in that. Today, my team member Stephanie Lung and I will provide a brief overview of advanced care planning and some tips and tools to help you feel more confident with conversations around healthcare decisions. So let's talk about advanced care planning. People don't need to wait for a physician to begin the conversation. The internet has lots of resources to help people get started in the privacy of their own homes and on their own timelines. The important thing is to start thinking and then start talking. Have a conversation with those closest to you. Take the time to consider what matters to you at the end of life. Formally documenting your decisions does not mean you cannot change your mind and your plan as your circumstances change. Documenting those decisions helps physicians to practice patient-centered care when they know their patients' values and goals. So planning is bringing the future into the present so that you can do something about it now. We plan for the birth of a child, a wedding, going off to college, and retirement. Despite the conversations we have for these other important events, we rarely have conversations about how we want to live through serious illness and how we want to be cared for at the end of our lives. We talk about advanced care planning in 3 stages. The first stage of advanced care planning is for all healthy adults. You want to name a healthcare power of attorney. And Stephanie's going to go into a little more detail about choosing a healthcare power of attorney in a minute. The next stage of advanced care planning is adults living with a chronic illness. For example, when someone has just been diagnosed with COPD, or chronic obstructive pulmonary disease, you might say something like, "This is a new diagnosis for you. What we know about COPD is that it's a chronic and progressive illness. It's a health issue that you'll be managing for the rest of your life. And now's a good time to start to learn about the potential complications you could have with COPD and what treatment decisions will need to be made in the future." And the next stage, the third stage of advanced care planning, is for adults who appear to be in their last 1 to 2 years of life. Perhaps their chronic illness has progressed. Maybe they're starting to have repeated infections, more medications, a hospitalization or 2, more symptoms of their illness. Maybe it's a new terminal diagnosis. This is the stage where we need to discuss goals of care and getting specific about what they want or don't want, and making sure the healthcare power of attorney is included along the way in case they need to step in. I'm going to turn it over to Stephanie now to get into a little bit more of the specifics of advanced care planning.
Thanks, Laura. Hi, my name is Stephanie Lung, and I'm the Project Specialist for Advanced Illness Programs at HOC Navigators. I'm a certified advanced care planning facilitator through Respecting Choices, and I've taught the Advanced Steps curriculum for 4 years. I'm going to take a little deeper dive into advanced directives and how you can empower the patients and families you serve help complete them. In the living will, patients document their wishes around life-sustaining treatment. This can include withholding or withdrawing any medical procedure, treatment intervention, or other measures that, when administered to a patient, mainly delays the dying process. It only goes into effect when the patient no longer has the capacity to make their own healthcare decisions and are in a terminal condition or a permanently unconscious state. This document does not appoint a representative to speak or make decisions on their behalf. The other document is the healthcare power of attorney. In this document, patients name an individual to make their healthcare decisions on their behalf only in the event the patient cannot make decisions for themselves. These documents are available for individuals to complete on their own at no cost. For it to become a legal document, it must be witnessed and signed by two individuals who are not related to the patient or named in the documents, or it can be notarized. When talking to patients and families about these documents, it's important to stress that these documents are instructions about future care if the individual is unable to make decisions for themselves. These are also state-specific. So if the individual travels between states or if they live in a different state than they receive care, it's important to go ahead and complete both states' advanced directives. When helping patients think about who to name as their healthcare power of attorney, there's many things to consider. Here's a list of example questions to have individuals think about. Will they be okay making decisions on your behalf, even if they have different beliefs? Will their emotional connection to you get in their way of their ability to make tough decisions? Will they be able to stand up for you, especially if there's others who have different viewpoints or opinions? Will they know what questions to ask, or ask clarifying questions if they don't understand something? Will they be able to make decisions quickly? It's also important for them to talk to the person they've identified as the healthcare power of attorney and let others close to them know so there aren't any surprises if a situation comes up and the healthcare power of attorney is called upon to make the decisions. All of these tips can be found on the Conversations Project's toolkit, How to Be and How to Choose a Healthcare Proxy. It's important to talk about this often. Individuals' wishes and goals can change as their situation changes. Starting the conversation with older teenagers is a good idea to help normalize the conversation. Other major milestones are good opportunities to revisit the conversation. For example, when an individual gets married, their next of kin changes from their parents to their spouse. There's also the 5 Ds that are great opportunities to revisit the conversation to ensure everyone is on the same page regarding goals of care and values. If there's a death in the family, it's an opportunity to reflect on that death. Do you view that as something that would be acceptable for you, or would you have preferred things to go a little bit differently if it was your situation? It also might be a time where you may need to update your documents if your healthcare power of attorney was the one who died. If there's a divorce and you named your former spouse as your healthcare power of attorney, you may want to update it and choose somebody else. If there's a new diagnosis, as they begin to understand their new illness and what complication may arise. If it's been over a decade since you've reviewed the documents, it's an opportunity to revisit and review. Or if there's been a decline, whether it's a decline in mental status or just physical condition, again, opportunity to revisit the individual's goals and values. The quote, "Make advanced care planning a routine part of healthcare. Discuss it with all patients, the sick and the well, young and old, and keep the conversation going. Tailor the conversation to the patient's health status and clinical circumstance." This is especially true in the era of COVID-19 and the uncertainty around how an individual will be affected by it. If nothing else, this pandemic has taught us how important it is for everyone to think about and be prepared about future healthcare. Dr. Atul Gawande, a surgeon and author of the book Being Mortal, has 5 questions that he recommends healthcare professionals ask people as they start the advanced care planning process. First, what do you understand about your illness? Oftentimes we assume people understand what their illness means, especially if they've had it for several years. It's important to take a minute, have them explain to you in their own words what it means, and if needed, provide them with additional resources and information to help fill in the gaps. What is most important to you if your time is short? Understanding if quality or quantity is most important. And if quality, what does that look like? Some things to think about. Who would you be with? What would you be doing? And where would you be? The last 3 questions are different ways of asking similar things to better understand a person's goals and values. What does a good day look like? What are you willing to give up? What are you not willing to sacrifice? I've heard some people say, as long as I can hold the remote and watch TV, I'm good. Others, they say, if I can't be sitting up at the kitchen table with family and friends and having a meaningful conversation, that's not quality of life for me. And now Laura is going to share a personal story around advanced care planning.
Thanks, Stephanie. So yeah, I do have a personal story of advanced care planning from my life about my dad. My dad was in his mid-80s. He didn't have any imminently life-threatening diseases. He took a blood pressure pill. He had the signs of mild heart failure with swollen feet, and he took pain medication. He had terrible arthritis in his hip, and he was in almost constant severe pain. He had very little mobility because of his pain. He needed help with all movement. Going up 1 step with the assistance of 3 people was like climbing Mount Everest for my dad. For about the last 10 years of his life, he would often bring up his wishes regarding the end of his life. He was always mentally very sharp. He knew what he wanted and he would say it. He'd say, "When my time comes, let me go. None of that baloney." He had strong feelings about these things. And although my mom, my brothers, and I had all heard and understood his wishes, nothing was in writing. I was finally inspired by a conversations packet, Conversations of a Lifetime, and went back home to Northeast Ohio one weekend with the packet and a plan to sit down with my parents. They knew all about the plan to sit down at the kitchen table and complete advanced care planning paperwork. My dad enthusiastically agreed. My mom fretted through the whole thing. My dad designated me his durable power of attorney for healthcare because he knew the difficulty my mom would have with the role. We wrote everything down, but I think the most important part of that conversation was that my mom heard him clearly say what he did and did not want, and it was written down. A year or 2 later, one day my dad began to have a slurred speech. He was very alert, but could barely get his words out. He could only nod or shake his head, gesture, and point. Mom somehow got Dad to his primary care doctor, who promptly sent him to the emergency department. They wanted to admit him. Long story short, my dad clearly communicated without speaking that he was not agreeing to be admitted to the hospital. The doctor explained to him, and my dad understood the risk of his decision to not be treated. He left the hospital against medical advice. My mother wasn't comfortable with this, but even though he wasn't using words, he was communicating clearly. I came home from Cincinnati. Dad's PCP, his doctor, made a home hospice referral. We cared for Dad at home until he died about 2 weeks later, peacefully and surrounded by family. This was the ending that my dad had wanted for his life well lived. That was in 2016, and my mom still occasionally brings up the question, could my dad have lived longer if he'd been admitted to the hospital? That's an unanswered question, but I refer her back to our kitchen table conversation when my dad so clearly stated what he wanted and we wrote it down. And she nods her head. This helps her and it helps me to know we did what he wanted. And now Stephanie has a story to share from her life as well.
Thanks, Laura. The story that I'm going to share is about my mom, and it's a little bit different than the one you just heard. So with her, I don't really remember a sit-down conversation, but I do remember, occasionally at random times, my mom would say something around how she would or wouldn't want to be cared for at the end of her life. Both of her parents died from cancer, so she had been through that situation before. We would be watching TV and she'd say something like, "Oh, I wouldn't want that to happen," or, if I don't know who I am or who you guys are, I don't want any heroic measures done. And then about 15 years ago, there was somebody in our community who suffered a massive heart attack and as a result had a massive brain injury and was very debilitated and unable to care for herself. And I remember my mom clearly saying, if anything like that happened to me, I would not want to live like that. I would not want to be on life support or have any machines keeping me alive. Then 4 years ago, the unthinkable happened. She had a heart condition we weren't aware of and went into cardiac arrest. They tried to revive her, but it was too late. During the moments of uncertainty of what was going on, lots of things were going through my mind, including what would her life be like if they did bring her back? What would that look like and what would that mean for her? So over the years and working through my grief, I often reflect on what she had said, and in some ways it's helped me come to terms with her death. I share this story with you because thinking about worst case scenarios and having those often difficult, uncomfortable conversations with key people in our lives can help save considerable heartache, stress, and guilt for our loved ones should the unexpected happen. So thinking about having those conversations, it can be very overwhelming to even think about where to begin. So we have a lot of resources on our website, and in fact we just redesigned our website, and everything that we brought up and mentioned today is housed there. You can still visit us at conversationsofalifetime.org, and it includes the conversation starter kits, the advanced directives, as well as links to all states' advanced directives. If you have any questions or would like to reach out to us for more information after today, you can contact us at our emails listed here. And thanks again for joining us for National Healthcare Decisions Day.